Welcome, everyone. It's great to be here with you today. It's great to be up here on the 8th week of being the Stanford Healthcare CEO. One of the things that attracted me to this organization is the heart of being in the Silicon Valley. Now, I am more impressed because I was a little worried about the audience attendance today. There's something happening in technology today that people are waiting on the streets of Palo Alto for. I'm glad that you're not worried about your iPhone 7 and you want to be here to learn, so thank you. I'm excited to be here because we are looking at new ways of partnering in healthcare. We're looking at how do we involve the patient in that process. You wouldn't think that that would be a new term, but sometimes it is. How do we also engage those constituents that are an important impact to healthcare? And that's our partners in the community. And I can tell you, Stanford Healthcare, just in the short period of time that I have been here, is pushing the bar in those areas. And I want to share a little bit with you about that. Is there any doubt that transformation is upon us? The only constant seems to be change. And as we think about the things that we are working on, the things that we are trying to do, are we being innovative in that change process? Are we making sure that we're pushing the bar, that we're pushing the boundaries when you think about what innovation needs to occur to position us well to be successful in the future? Now, one of the quotes that I love, and again, now that I can use this quote because he's actually a Stanford alumni, is Jim Collins made the comment in the book Good to Great. He says, once you think you're great, your slide toward mediocrity has begun. The reality is, if we aren't innovating, if we aren't pushing the bar, we will be obsolescent. And so what is exciting about here are what are those things that we're doing to push the bar, and I feel that Stanford Healthcare is extremely well positioned to do that, and I want to share with you just a couple thoughts about that. Now, we know that healthcare is an evolving landscape. The only constant it seems to be in healthcare is it's going to change constantly, that we're going to have lots of opportunities to do new things. We have lots of people who love to pay us and then take that money away and not pay us or tell us how they will pay us. We know that the patient, though, is the first and foremost in what we're looking at. How do we make them the center? And we are literally changing what, when, and how we provide that care. What are those new and innovative ways that we have to do that? At the same time, we know that networks, this is just an easy way of saying, how do we collaborate in doing this together? And I wouldn't say that we're always the best to do that. We're sometimes myopic in thinking the way we approach, the way that we do our work. And it's important that we reach outside the bounds of what we're doing today. Now, we've all heard of accountable care organizations. We've heard of population health. Population health is kind of boiling the ocean. It really is a way of taking a look and saying, how do we make the care more personalized to the individuals, while at the same time reducing the healthcare expenditures that are associated with that. And then we also know that technology is going to drive, not technology in search of a solution, but how do we take technology and apply it to the solutions we need to truly transform healthcare? And that's what I want to touch on, just a few items. So those 6 ways that we are looking at, let me touch on briefly, but I want to talk about deploying new technology. We have a lot of opportunity here when we're looking at that. Actually, we have an artificial intelligence lab here at Stanford. Very exciting. I have to say, 8 weeks ago, I didn't know we had an artificial intelligence lab. I'm very excited about that. Maybe it can help me in that artificial intelligence aspect. But we're actually using technology, again, through headsets to detect slight variations in patients' conditions through eye movement, through whether they are in pain or not, to actually be able to predict their outcomes in the ICU. How exciting for us to be able to use technology. It prevents us from having to use costly monitoring, but it also helps us to be able to help them recover more quickly by noticing what their body is telling us, as opposed to what we're used to looking at. At the same time, how many of you have your PDAs? How many of you probably can separate from your PDAs? That's a difficult process. And so what we have said is, why not enable you through your own devices to be able to garner information about your health? We have a great electronic medical record within our organization called Epic. Epic actually has an application called MyChart, We actually have 270,000 users of MyChart in our organization. Now, because we are innovative, we had to change the name, so we call it MyHealth. That's one of those important things. But we can now push information to you. We can allow you to schedule appointments. And those aren't new things to MyChart, but one of the things I'm excited about, we can actually have an app now that we have developed that actually looks proximally to when you come into the clinic, that knows that you're there and can actually check you in. How many of you enjoy waiting in lines to check in when you get to the doctor's office? We can do that electronically now. How do we deploy that technology really to, again, enable the patient? We are collecting huge amounts of data. Whether we're wearing things on our wrist that's collecting that, where we have our PDA through the MyHealth app, whether we are looking at our electronic medical record, the question is are we using that data to turn that into knowledge to make decisions in your care? I can tell you, we are looking at how we do that. A couple examples here. The medicine reconciliation process. When you come into the organization, do we know the pharmaceuticals that you're on when you hit the ED as opposed to what you go out on? Are there conflicts of those? Do we have the ability to be able to take aggregate data across our system and identify those things that when you get discharged from an inpatient unit actually cause you to bounce back? Can we look at our data set and actually prevent that from occurring? At the same time, are we using that data and some of the science that we have internally? And this is one of the projects I'm particularly excited about. We hear a lot about genomic data. How do we take that genomic data and apply it to our individual health to make sure that we're being proactive? One of the things that we're doing is actually taking some of the inherited diseases that we know through genomics can actually be predicted, and actually using an application with Google to actually use that genomic database to be able to look across large data sets without sharing information. We want to make sure that HIPAA piece is in there, but without sharing that information, but look at those aggregated data sets to actually do more predictive modeling. And this partnership with Google, I think, is an innovative platform to do that. At the same time, we have to reimagine the work. We have traditional models and mindsets within healthcare. We have, I hope you had a great opportunity to come walk past our new facility coming in today. We're a traditional hospital setting, but at the same time, we've got to reach outside of that network to partnerships in our community, whether that's working with physicians, whether that's working with community docs, whether that's working with our own faculty, sometimes whether that's working with our payers in a more collaborative way, which certainly is an opportunity for us into the future. I can tell you, everybody is interested in change as long as somebody else goes first. And so the reality is how do we inherently start that innovation and change on our own? I also love, and I have to throw in here because, again, the digital health platform is so paramount to, again, enabling us to more appropriately bring that information to the market. We also are challenging assumptions. We know that you have to visit your primary care physicians. We know that you visit doctors. We want to be able to re-enable that. We have started a program with our primary care physicians that actually partner with the patient. You have a team-based approach. When you come in to Primary Care 2.0, you have a team of individuals interested in your healthcare, making sure you have the right clinical information, the right diagnosis, the right test. We are also, through a QuickWell app, allowing you to be able to actually interact with us virtually online. Would some of you appreciate not having to go into the doctor sometimes and waiting in that line? We actually have that opportunity to do that. But also, are we doing that to partner with companies right here in the Silicon Valley? We have partnerships with Cisco, Yahoo, and even Qualcomm down in San Diego to create on-site clinics in your organizations so that you have the opportunity to not travel. Again, how do we look at that innovation? How many of you occasionally look online before you make purchasing decisions? Let me get a show of hands. I'm sure the audience out there telephonically and on video is raising their hand as well. If you didn't see pretty much every hand raised, we use data from consumer blogs, etc., to make decisions. In fact, 80% of us trust that data online more than we trust our friends to tell us what is the best way to go. I can tell you, having just moved into this area, I looked online quite a bit as I was making decisions. And we are influenced by those decisions by what other customers tell us. We know that in healthcare as well. That's why we have actually taken our data, put that data online that tells what our patients are saying about us. We have our Prescale data that shares with others what their physicians are like. Not only the quantitative data, but also the qualitative comments that, again, you have the opportunity to be able to read before you come in. We also know that this enables, the digital health platform actually enables higher patient satisfaction because you like to be able to have that opportunity to interact with us electronically. So we're actually innovating from the ground up, and I say that because we are developing that new facility that you got to see, hopefully, when you came in. This little bitty $2 billion project that we're building out front, I'm like, really, that much when I came in? It's like, this is exciting. But I will tell you, this will be the most innovative, technologically sophisticated hospital in the world when this is open. It is amazing to see what is going into this. More importantly, this is for our community. This is for our patients. How do we create an internet-like hospital that allows you to be able to interact with that, whether that's through wayfinding, whether that's through the data that you need back? Also, as you can see, also looking at tools that allow us to actually track patients, track equipment, track technology throughout. So it's exciting to see what we can partner with in terms of the community, in terms of technology, and creating innovative platforms to come back to care for our patients. At the same time, we want your vision to navigate us to be driven by the technology that you see too, whether you're at home, whether you're seeing us in our clinics. We have over 1 million clinic visits a year. We have more than 1.7 electronic interactions with our physicians through online and digital technology. How do we push innovative solutions to you and interacting with us in the way that you want? And that's an important aspect of what we're looking at. At the same time, we have to apply that Stanford edge. Part of the reason that I came here, we obviously have a tremendous brand with what Stanford is and what we embody in terms of the science and the research. We have an incredible opportunity to be able to apply that technology not only to the science that we're discovering, but also to the ability to apply that to our patients and the care that they're getting. We have a great opportunity here in leading the biomedical revolution. And in fact, we look at the partnerships that we have with our School of Medicine, with Stanford Healthcare, with Lucille Packard Children's Hospital is a great platform to be able to apply that science across a wide venue, but more importantly, to be able to benefit the patients that we serve through that science and discovery. So join with us. Healthcare is only truly great if the patient thinks it is. We may think we're doing wonderful things, but unless at the end of the day the patient sees that. Thank you for being here today. Thank you for joining us at Medicine X. I hope that you see that this is a time of discovery, a time of innovation that's driven by the discussion and learnings that you have here today. Thank you.